Perform care under fire. You are under fire at this time, and you'll return fire and take cover until fire superiority is achieved. Direct the casualty to return fire, move to cover, and administer self-aid, stop bleeding, if possible. Note, if the casualty is unable to move and shows no sign of life, the casualty can be tended to after the area is secure. If the casualty shows signs of life but is unable to move, you are unable to move the casualty, and the casualty is still under direct enemy fire, have the casualty play dead.
Bang, bang, bang. Battle buddy, move and cover. Apply self-aid. Return fire.
Enemy fire has been suppressed. Approach the casualty in a battle buddy team. Use smoke or other concealment if available, using the most direct route possible. Note, your battle buddy will pull security while you stop life-threatening bleeding, if applicable, on the casualty. You and your battle buddy will then move the casualty to a secure position before continuing assessment and treatments required.
Battle buddy, move up with me. Security, maintain a perimeter.
Administer life-saving bleeding control. You'll determine the relative threat of enemy fire versus the risk of the casualty bleeding to death. You may need to move the casualty to cover before applying a tourniquet. Suspect severe life-threatening bleeding from an extremity or an amputation of an extremity. Administer life-saving bleeding control by applying a tourniquet from the casualty's IFAC before moving the casualty. Move the casualty, his weapon, and mission essential equipment to cover. Perform tactical field care. Note, when evaluating and/or treating a casualty, seek medical aid as soon as possible. Do not stop treatment. If the situation allows, send another person to find medical aid. Establish a security perimeter in accordance with unit tactical standard operating procedures and/or battle drills. Maintain tactical situational awareness. Remove weapons and communications equipment from casualties with an altered mental status. Check for responsiveness if not already established. Ask in a loud but calm voice, "Are you okay?" Gently shake or tap the casualty on the shoulder.
Battle buddy, are you okay?
Determine the level of consciousness by using AVPU. A, alert, V, response to voice, P, response to pain, U, unresponsive. To check a casualty's response to pain, squeeze the first or second toe or finger over the nail. Alternately, pinch the casualty's nose or earlobe. If the casualty is conscious, ask if his body feels different than usual or where it hurts. Then identify and control massive bleeding.
Battle buddy, are you okay?
Perform a blood sweep of the extremities, neck, armpits, and groin areas. Exposure is only necessary if bleeding is detected. Note, for life-threatening bleeding to an extremity, not previously controlled during the care under fire phase, or an amputation, apply a tourniquet directly on the skin 2 to 3 inches above the wound. If bleeding is not controlled with the first tourniquet, apply a second tourniquet side by side with the first. For life-threatening bleeding where a limb tourniquet cannot be applied, use combat gauze. Reassess any tourniquets placed during care under fire to ensure they are still effective. Note, if wound or amputation is still bleeding, attempt to further tighten the tourniquet until bleeding stops. If wound or amputation continues to bleed, place a second tourniquet side by side, but above the other tourniquet. Do not cover tourniquet sites and clearly mark time of application with a permanent marker. Position the casualty and open the airway. Assess for breathing and chest injuries. Look, listen, and feel for respiration. Expose the chest, check for equal rise and fall of the chest, and for any wounds. Apply an occlusive dressing if casualty has a penetrating chest wound. Treat bleeding that was not addressed earlier with an emergency bandage. You now assess for shock from blood loss, verbalized.
I am assessing for shock.
You would prevent onset of hypothermia, verbalized.
Preventing onset of hypothermia.
Assess and treat penetrating eye trauma, verbalized.
Assessing and treating any penetrating eye globe trauma.
Assess for and treat any additional wounds found, verbalized.
Assessing and treating for any additional wounds found.
Check the casualty for burns, verbalized.
Checking the casualty for burns.
Communicate with the casualty if possible. Encouragement and reassurance are helpful to the casualty. Explain all assessments and treatments. Administer pain medications and antibiotics, the casualty's combat pill pack, if available, verbalized.
Administering my combat pill pack.
Document the injuries and the treatment given on the casualty's own Tactical Combat Casualty Care Card, DD 1380, found in the casualty's IFAC, verbalized.
Placing any and all treatments on the 1380 and applying to the casualty.
Supply information for lines 3 through 5 of the 9-line medical evacuation medevac request to your tactical leader, verbalized.
Supplying lines 3 through 5 of the 9-line to the tactical leader.
Continually reassess casualty until medical personnel arrive or the patient arrives at a military treatment facility.
Continue to reassure the casualty and take care of them until medical care has arrived.